My question is to the Acting Premier. Acting Premier, Ontarians with chronic diseases should be concerned about this government's actions today. Every day, Ontario's 28,000 doctors go to work and put patients first, many of them with chronic diseases. For doctors, it's simple. There's no job more important than the health of their patients. But this government is attacking those very doctors and their patients with heart disease, kidney disease and diabetes as they are seeing their health care cut in order to pay for Liberal scandals, whether it be the gas plants, eHealth, Orange, or their failed diabetes registry. These scandals cost Ontarians billions. You've cut over $800 million from patients to fund your scandals this year alone. In fact, this past spring, you secretly shifted $54 million from the federal health transfer to non-health programs. Mr. Speaker, why is the government cutting health care services to the sickest in the province to pay for their scandals?
Thank you, Speaker. And the member opposite knows better than to ask that question. He knows full well that government has to make choices about where their dollars go. And when we see, for example, when we saw that Ontarians were paying
member from Bruce Grey, Owen Sound, the member from Nipissing.
As a pharmacist, the member opposite thought we should not cut the prices of those drugs. I guess my question to him would be, do you still believe that we should now increase the price of drugs and increase the compensation to pharmacists? I don't think so. We have to make tough decisions. One of the tough decisions that we're making is that physician compensation has an envelope. We must live within that envelope. That does not cut patient care. All it does is cut compensation to physicians, Speaker, because so we can expand care
member from Prince Edward Hastings.
Of our system.
Thank you. Supplementary.
Speaker, I think the people at home should remember that everything this minister says equates to, she still claims that the Cashback scandal only cost $40 million. Yeah. It's all bung, pure bung. Back to the Acting Premier. Your cuts to chronic disease management are not small. In fact, they don't even make sense. Studies show early detection and treatment of complications is key to reducing costs and having healthier outcomes. However, the cuts to doctors will negatively affect treatment for diabetes and heart patients. Rural and Northern Ontario will especially be hit hard because specialists are scarce. This government has cut 35% to doctors who treat heart failure, 33% to doctors who treat diabetes. Wait lists will grow, the sick will get sicker, access to doctors will shrink, and healthcare costs will skyrocket due to the government's imposed cuts to doctors. Why are you trying to create a crisis in healthcare, and why won't you return to the table with doctors and seek a solution that achieves cost?
Be seated, please. Be seated, please. Thank you. Deputy Premier.
Speaker, Ontarians are blessed. We have the finest doctors anywhere. We are enormously proud of the work that our physicians do, and they are paid in accordance with that. The report yesterday from CIHI demonstrated that, on average, a physician is billing $368,000 a year, the best in the country. Your argument that we should increase compensation to physicians means we must take that money from somewhere else. I am not prepared. It would be irresponsible to take money out of home care, to take money out of drugs, to take money out of things like devices like hearing aids, Speaker. That would be irresponsible. We had a process in place that was mutually agreed upon between the OMA and government. We followed that process. Yes, we brought in a mutually agreed upon mediator, then a mutually agreed upon conciliator. The OMA didn't like the answer.
Thank you.
But, Speaker, we had the...
New question, the member from Nickel.